Kevin Quishan, one of the resident faculty here at Spear Education, and welcome to a team course on occlusion, and we're going to specifically in this course look at muscles. And in this course, we're going to identify the 4 components that affect occlusion. We're going to actually then take a close look at the key muscles of mastication. And then finally, we're going to look at the impact that the muscles play on occlusion or that occlusion plays on the muscles. So the first thing I want to do is let's just identify the 4 components of occlusion. Just a quick reference or to help orient us on where we are within the process of facially generated treatment planning, because that comes up a lot probably in your practice. So when we're treatment planning, the 4 categories are aesthetics, function, structure, and biology. These components that we're talking about, or this area, is really just that one category of function. So what are the 4 components that sort of fit right in there that we do our exam and evaluate during treatment planning? So the first component is the joints, or the temporomandibular joint, and of course we have 2. And the joints are an interesting part of the system in our bodies because it is really the only joint in the body that is made to dislocate. In other words, the ball, just like any other joint in your body, the ball is made to be centered in the socket. It's an orthopedically stable position, right? But when we open, the ball actually comes out of the socket. It is made to come out of the socket, and there's a little disc, a cartilaginous disc on top that actually comes with it. And so it travels with it. You can almost think of that for safety. And so then when it comes back into the socket, the ball seats in the socket, and that little piece of cartilage is in between the ball and the socket. And so again, what I want you to really take home from this as far as the joints go is that ideally, when we bite together, the ball is centered in the socket with that little piece of cartilage right on top of it to protect the bone from bone contact. So that's the first of the 4 components in general. Let's move on to muscles. And there are so many muscles that come into play in the masticatory system that do so many different things. We have some muscles that squeeze our jaw so that to help our teeth touch. We have some muscles that help bring our jaw forward, and we have some muscles that just sort of stabilize the system. But in general, what we're looking for is for muscles on the right side and the left side to work in harmony with each other. So when I'm biting together, I want my right muscles squeezing at the exact same time as my muscles on the left, and not one a little bit before the other. And what they want to do is guide my jaw together and stabilize my jaw once I'm shut. So that is the role of the muscles in the masticatory system. The third component are your teeth, right? And teeth are an equally as important component of the system. And what is the role of our teeth is when we bite together, we want all of our back teeth touching evenly and simultaneously. So again, let's bring the other 2 components into play. So we'd like the ball on the socket, with the muscles contracting at the same time. But now when we do bite together, we would like all of our back teeth touching evenly and simultaneously. So the right side and the left side, back teeth touching at the same time, but we also want our back teeth touching just slightly heavier than our front teeth. We want light contact on our front teeth so that when we move our jaw from side to side, our front teeth rub against each other in a very nice way and guide our back teeth apart, or immediate posterior disclusion. And that is the role of the teeth, and that's really as much as we need to say about that right now. And then the 4th component that I call the 4th component, or what's really sort of 3A, is the periodontium, because the role the periodontium plays is integral as well. If our teeth are mobile at all, when we bite together, it's going to shift our bite. Or conversely, when we bite together, if our teeth are not touching in an ideal situation, it actually might cause our teeth to get loose or frematous or create some inflammation in the periodontium. So that's why it is a key role in the masticatory system. If our infrastructure, if what's holding our teeth in is not stable or is not disease-free, it's going to affect the other components of the masticatory system, the teeth, the muscles, and the joints. So I hope you can, minimally, we can see how the 4 components work together and how if one component is out or out of whack a little bit, it might affect the other 3. And again, that's what we're going to look at in all of these courses on occlusion.